is Ruby. I'm going to be doing the PPE check. So, first thing I'm going to do is I'm going to check my patient's medical record and nursing care plan. And to make sure that I know if they have any precautions I need to take before going to the room and any specific PPE I need to put on. So once I see the patient's medical record and or nursing care plan, I'm going to follow the precautions accordingly. I'm also going to refer back to the infection control manual and making sure the precautions we're taking and I'm about to take for their specific condition are the right precautions according to the manual. So once I read all of that over, I'm going to plan the activities I'm going to make with my patient. So with this specific patient, I'm going to be taking their blood pressure. So I'm going to make sure I have everything I need. Then I'm going to assemble my PPE, put it all together. I'm going to grab all my PPE. So I'm going to need clean gloves, a mask, goggles, and a disposable gown. So once I have everything put together, I'm going to perform proper hand hygiene. So proper hand hygiene, and then I'm gonna commence my putting on of the PPE. So first I'm gonna grab my gown and I'm going to put the sleeves in, and then I'm going to tie the strings, if I can find them, and secure it at the neck. And then I'm going to secure it at the waist. Okay, once this is secured, I'm going to put on my mask. And since this mask is these strings rather than the earpieces, we're going to put this one on first. So we're going to secure these. And then with the mask, I just want to make sure that it's properly covering my nose, my mouth, and my chin. Okay. So now that it's properly put on, I'm going to put on my goggles. And then I'm going to put on my clean gloves. And then with the gloves, I'm going to make sure that the cuff of the gloves extends over the cuff of the gown sleeves. So, like so. Same with this one. I'm going to make sure it extends over. Gloves are really loose on me, so it doesn't stay very well. Alright, so now that it's extended over the gown, you're ready to commence with your care. So I'm gonna identify my patient using the two identifier method. So I'm gonna ask my patient, hi, can you please give me your full name and your date of birth, please? They're going to give me their full name and their date of birth. Okay, Jimmy John, December 20th, 1970. Great. Okay, so it matches my record, so we could proceed on with care. So now I'm going to just let them know what I plan on doing with them today. So Mr. Jimmy John, today I'm going to take your blood pressure. All right, he says it's all good, we're all good. So then I'm going to do my care. So I'm going to take his blood pressure. Take his blood pressure. Da, 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 da. Great, your signs are looking great. So then I'm going to, now that I'm done, I'm going to take off my PPE at the doorway. So I'm going to do everything but the mask. The mask, I'm going to do it outside the doorway because of COVID and all, we can't really be taking off our mask. So the first thing I'm going to do is I'm going to take off my gloves. These are the dirtiest. So I'm going to grab the outside of the cuff, and then I'm going to roll inward, making sure I don't touch. And then with these two fingers, I'm going to grab the inside of the cuff, which is the clean part, and then I'm going to roll out too. And then I'm going to dispose it in the proper container, which is right here. Okay, great. So now I'm going to take off my my goggles. And I'm going to put it in the correct receptacle to get either reprocessed, or I'm going to dispose of it if they're disposable. So mine are disposable. So I'm going to throw them in the proper container or set them down gently. Then I'm going to take off my gown. So first I'm going to untie these. Great. The goggles, by the way, I'm not sure if you noticed, but I took them off by the ear pieces, so I wouldn't be touching the front of the goggles because it can be contaminated. So once I take off this, I'm going to take off the necktie. Great. So now I want to make sure that I don't touch the front of the gown since it's considered contaminated. I'm going to grab the inside of the gown. I kind of pull it down towards my sleeves. And I grab the inside of my gown, pull it down towards my sleeves. I want to make sure that I don't touch the outside of the gown at any point. So I just took that out by only touching the inside. And then I can grab the inside and then pull it out, making sure I'm staying as clean as possible. So then we're just gonna roll. And then now that none of the contaminated part touched me and I didn't touch the outside, I'm going to dispose of this in the proper container. Alright, perfect. Then I'm gonna, now that I'm out of the doorway, I'm outside and I can finally take off my mask. So first I'm going to take this mask off. Then I'm going to take this mask off. And then, in this case, I'm going to dispose of it in the proper container. And then I'm going to perform proper hand hygiene right away. Yeah. Thank you.